And we're gonna do live on Facebook. Yeah, I'm just gonna stream it into the group. That'll be fun. Pretty serious.
There may be a little bit of noise when the dogs come back in.
Yeah, that's okay.
Okay. I'll try and mute.
Yeah, I'm gonna pause this really quick. Okay, there we go. Okay, thank you so much for being here, Donna. We are here. We're going to take a few questions from you. So if you are watching this, please just, and obviously if you're seeing this, you're on the page, you're not in the group. Let me post really quick about that. Look on the page. Please go to. Facebook.com. Sorry, thanks for bearing with me.
That's the important stuff.
Yes. Like my messages are exploding. I can't get into the Zoom. You're not supposed to get into the Zoom. Okay. Well, I need this. Okay. So, Donna, I'm gonna we'll just take it from the. I don't know if you have your sheet in front of you where you can see that the thing that I messaged earlier with the notes. Oh, good. Captions are going. That's great.
Awesome. Well, I thought maybe it would be a good idea to start with how to prepare for your appointment to begin with before you ever get there.
Oh, that was yeah.
So I agree completely. Yes, yep. Awesome idea.
So, yeah, one of the best things you can do is you sit down and obviously when we're dealing with long COVID, we have over 300 symptoms. That's a lot. No doctor is going to sit there and be like, absolutely, tell me 250 of your worst. No. Go through and make a prioritize what symptoms are bothering you the most, because a lot of times with given time constraints, they might have time for like 3 things. Right. So you really have to kind of pick and choose it, and it's not that they don't want to, it's just literally there is not enough time to go in depth on these things.
Absolutely. And they do sometimes do a little prep work if they know you're coming in for a particular condition, like a cardiac issue or a lung issue. They'll do a little prep work and look and see, do you have testing that they can reference? Do you have previous history they can reference? So it is important not to throw a bunch at your doctor at one time and just stick on task. I think one of the easier ways to do that is to use your symptom journal. I know a lot of people are keeping that symptom journal that tells you what you're experiencing when, and you can kind of get a better idea of the things that are most important by what's bothering you most frequently and most persistently. That helps a lot in narrowing down what you describe to your doctor.
Yeah, and I gave up on my symptom journal like, I don't know, 10 years ago. How long have we been doing this?
Yeah, like 2.5 years. Feels like 20.
Yep, it does. There's a really cool app called Dailyo that I was using for a while to kind of keep track of things. And I think one of the groups that we've been working with out of Maryland, University of Maryland, they were working on like some type of an app, but I can't remember exactly what it was.
At first I used something called People With, and
okay.
Yeah, that was helpful for me too.
That's cool.
Just to do it electronically so that you have the same thing come up all the time. But paper and pencil work just as well, because to be honest, if I do a daily check-in, I usually forget what happened in the morning if I do it by the afternoon.
Well, one thing that I don't know, I have little sticky note pads all over, and I keep a pen and pencil by it. So as I think of things, I'll write it down there. And then I'll go and take that sticky note and put it in like a notebook so that they're all kind of in one place. Right. So that way I'm writing things down as I think of them. Otherwise, it will just be gone.
Yeah, it's really not a good idea to rely on your memory. So that's a great idea.
What's your name?
Yeah, why am I here again? I don't really know.
Not sure. Yeah. That's been one of my fun tricks for everything, not just symptom or COVID related, but like a lot of things, keeping everything organized. I'll think of something. I need to write it down right away.
Yeah.
And then I'll just stick it in my note. I'll stick it in my notebook later on. So it's all
Right.
kind of a messy, organized blob of everything.
I kind of do the same. I have files, little file folders that I'll put things in, like test results or doctor's notes that I print off or whatever that I need for the next appointment, so that I have it kind of in one place. Um, and then I just grab that and go with me, because they do, some doctors link together through the electronic systems, which are great, but I've had a lot of experience here where they don't hook up, and then somehow or another, the records get lost in transit when you show up for the appointment. And you're like, well, I have this testing that shows something, but I don't remember the values, and I don't, and I can't show it to you because I don't have it with me. So I do try to print out things and have with me so I can present it. That goes a long way towards helping prove things, rather than just stating, I think I'm anemic. Then you can give your doctor your paper that says, well, yes, actually you are slightly anemic. Yeah.
Yeah, that's all of my medical records are in one place except for the long COVID clinic in that hospital system, and it's not in there, and it just drives me nuts because I've got records going back years on this on one.
Right.
But I need these over here with the long COVID stuff. So I will just take screenshots, and I'll send that to my doctor at the long COVID clinic so that he can go back and look, oh, okay, yeah, you do have a history of this, or this, this thing, like I found out I have a nodule in my left adrenal gland, and it's brand new. It hasn't been noted before.
Right.
And I went back through my records last night, like going back 15 years, never noted before, just brand new.
Fun.
But yeah, and also jot down not just your symptoms, but jot down any questions you might have, because we forget that too. Everything.
We do. And I was going to say, when you've got your symptom journal and you're jotting down your symptoms, it's a good idea to get data if you can. So blood pressure readings, pulse ox readings, any information that you have that's a number, an indisputable number that the doctor can look at, is really helpful. But yes, save lots of space for writing those questions, because you get in the middle of it and then you forget.
Right.
I've done the same thing, or get discussing one issue and almost the whole appointment's gone because there's so much to talk about. And it's not very fair to yourself to be limited in what you can do. So yes.
Sorry, there's a very loud car out here. I wish it would stop. It's
that's
very
okay.
annoying.
I'm apologizing in advance for whatever barking anybody hears, because
is that a symptom?
Yeah. Because the dogs will be barking too. But
yeah, any little thing. I again, with the Post-it notes, I do that all the time. And ask for help. Ask for help. Often there are resources that you might not even think of. Like in the state of Missouri, I don't know if this is true nationwide, but in Missouri, if you are on Medicaid, there is a transport service within a certain radius. So that's something your doctor is probably going to be like, I don't know, you just call it and do the thing. Ask to speak with a social worker or someone else, like in behavioral health. They can help arrange a lot of these things for you. There are probably a ton of things that you wouldn't even think of that'll make your life a little bit easier.
Right. Yeah, true. And within the appointment itself, I mean, most insurances have like nurse case managers. If you end up going to multiple specialists to kind of help you gather up what needs to happen when and how. And if you really are having significant memory issues, just having a really trusted friend or family member take you to your appointment and stay, so they can take notes and they can double check what you think you're hearing,
Yeah, well, depending on what their situation is COVID wise, like there are still some places that won't allow more than one person to go in.
Yeah.
So
if it's possible.
If it's possible, yes.
If it's possible.
Yeah, and if there's something you don't understand, don't leave your doctor's office until you've asked, hey, what is this? Like I had a lab value the other day. It was 12 what? What's the normal? There was no given range on this, like 12, like a baker's dozen. Is this good? Or 12? Oh, that's high. That's not good.
Right.
So I just sent my doctor a quick question. Hey, 12 what? Help a girl. I'm going to close this window. Everybody loud is driving by right now. All right.
All right. All right. So yeah, I agree that, make sure you understand what's going on, what the plan is, what your doctor's thinking before you even leave the office. And if he or she says something that just
Okay.
doesn't make sense to you, then that's the time to be asking questions. You need to be absolutely sure you understand what's going on.
Yeah, and that also gets to, things like informed consent. It's not just consent, it's informed consent.
Right.
If you don't understand, it's okay to ask. It really is okay. And don't worry about like time constraints. Like this is your health.
Absolutely. Now, I do think it's important to be respectful of
It
their
is, yeah.
time and yet not like add on, as we were talking earlier, 3 or 4 other things after your primary issues have been addressed. Be respectful of that. But yeah, it's important to make sure you know what's going on first and foremost. That's part of the job for them.
Yeah, and it's also okay to ask for a second opinion. It doesn't mean that you don't like the job that this doctor is doing. It may just be that a second set of eyes or a second set of ears might bring something else to the table. It's not an insult or a slam to your doctor. It's just, hey, let's see if we can find a consensus on something. What else could we be looking into?
Right. And I mean, sometimes it doesn't even have to go that far. It may be that for whatever reason, they weren't communicating very effectively. And so when they say something that maybe you weren't expecting to hear and you're a little flustered by, it's okay to say, what led you to that decision? What information did you have that gave you that decision as an option? And then what are the other options you're looking at? Are there other things that this could be besides this that you've ruled out for some reason? And why is that? And that can help you be more at peace with whatever is being said, because there are some really difficult diagnoses being handed down right now. There's some really tough things to hear. So you want to be sure that you're feeling secure with your doctor's communication. You trust what they're saying. And of course, if you feel like you are just not getting anywhere with asking for a little bit of help, if you've got a stone wall, you may need to go on to a second opinion somewhere else, then that's okay. That's perfectly okay.
Hold on, I'm getting a lot of messages like, I can't get into Zoom. It's not on Zoom. For us it is, for you it's not.
Yeah, right.
Live stream on the page, like several posts said. There we go.
Sorry.
Okay, thanks. Sorry. Brain bog.
Right.
Yeah. And it's easier, and make sure you do ask these questions before you leave, because if you have a question later on, you know how it is playing phone tag. It's not fun.
Right. It's true.
It's just, take care of it when you're there.
And I've even, when I was really confused by something that was said, I've even made a second appointment just so I had time to step back and process and figure out, okay, what am I thinking and what is this person thinking and how do I internalize all of this? And a second appointment sometimes is better if you've got a lot of questions and you don't know how to form your questions at the time, because I know I get that deer in the headlights look, like you said, what? What does that mean?
Well, that, and also it becomes a billing issue as well, because the way that our billing system is structured, there are 5 different levels of an office visit they can do. There's like a quick, like there's basically they can do anywhere from everyone is like, where is this? It's on the page. Put a link. Hold on. All
right. Well, anyway, they can do everywhere from a follow-up to a really in-depth appointment about a particular issue, I think is where you're going with that. And yes, that takes different time and that's billed differently. And sometimes it needs a second appointment just so that you can get through that issue, especially if there's testing involved or medication involved that you're not comfortable with or not sure about. You want to be able to ask those questions and really understand what your options are and what led your doctor, PA, nurse practitioner, whatever, to choose the options they decided to choose.
Yeah, and that let's see, and that kind of that's sort of, I guess, yeah, we covered that. So, and if you find that you just are not comfortable with your doctor, it's okay to find someone else. Like, I had a cardiologist last year who was he was like, well, just try to like keep your anxiety low, and I was like, excuse you, did you just say
Right.
the A word? Oh my gosh! So I sent him a very polite note back. You know, hey, it's kind of it's not really appropriate to be saying that to any long hauler. Um, and it's not anxiety. Of course, we're dealing with anxiety. It's because of the issues. It's not the cause.
Right.
And, oh well, that's not what he meant. Oh, I guess. But it's after a second round of this interaction with it. Like there was something else that popped up. I was like, you know what? I don't think this is working. I happen to have a friend who is another cardiologist in this practice with him, so I emailed him. I was like, hey, who's the most meticulous note taker in your office? I need Dr. That Guy. And he said, yes, absolutely. They connected me with Dr. That Guy. Dr. That Guy was great. He came in and said, what can I do? And I said, well, I just need you to take this thing up here in the body of the paragraph, put it down here in the impression so that people can actually see it. They're not skipping over it, because this is something that I'm not worried about it, but there's a pattern of this going with many long COVID patients. And if we're not catching up, if we're not picking up on these patterns, we're missing a piece of the puzzle. And this is something that I kind of want to keep an eye on. I'm not worried about it, but please keep an eye on it. So
Right. Yeah. And I think it's important to remember that you cannot assume all doctors are actually familiar with long COVID at this point. And I can't believe I'm even making that statement, but it's
right.
true. It's true. There are some who have only seen one or two people who have long COVID and don't understand all the intricate interactions of various issues in our bodies. Um, and it's helpful if you know somebody who has a really good doctor and can give you a name, or if there's a list that you can reference that gives you a name of somebody who's familiar, but it's not always possible.
Yeah.
And sometimes there's a little bit of give and take that has to happen as well. So it brings to mind one of my stories. I had a cardiology appointment as well. I don't know what it is with cardiology, but anyway. And this was relatively early, and it was like September of 2020. So long haulers really weren't in the news yet. They really didn't have any concrete ideas about what was going on with us. And I was having the usual, the chest pains, the tachycardia, the postural issues, dizziness. And she said, well, I think you've got coronary artery disease. And I said, I really don't.
So.
I really don't agree with that, but tell me why you think this. And she said, well, because, obviously your blood pressure is up, and maybe you've had some anxiety issues, and so your stress level is up. And I know anxiety.
Right.
So I let it fly because that wasn't my focus that day. She was saying something else. I said, well, what do you think you would need to show that definitively? And she said, well, there's this scan we can do, and it'll tell me exactly how many plaques are in your arteries. We'll do that. And then we'll talk about medicine. And because I think we should do some cholesterol meds and stuff. And I'm like, all right, let's do that test. So I did. And there were 0 plaques in my artery. 0. And we moved on to something else. She's like, oh, well, that's probably not it then. No, it really probably isn't. And then we did other more appropriate testing, which showed a problem that is very common, a dysautonomia problem. And so that was much more easy to navigate after that point. And when I came back to her after being put on medications and, doing all of the things, she said, I hadn't seen a long hauler until I saw you. And now I know better, but I had never had one, and I didn't know. We have to go with what we know. So it is really upsetting to have somebody tell you to your face, I think you have depression, or I think you have anxiety, or I think you just are making this up. That's horrifyingly upsetting, but it's sometimes coming from a place of less education than they need. And maybe if you feel like there's a way that you can approach that without totally alienating each other, because that does happen, and I've heard of folks walking out and closing the door behind them and never coming back. And I've done that too. If you can get there without alienating each other, you can have a better relationship with a doctor who might be able to provide you better care than your second choice or third choice or fifth or sixth choice or however many you have to go to.
Yeah, and I think that's one of the other frustrations is, okay, in order to get a chest CT, you have to do the X-ray first. In order to do an MRI, you have to do the CT first. And it's a frustrating little thing, and it's basically because of our billing system. You just kind of have to do it, and sometimes it might actually be for the better, because there could be something you could have the same scan, like you could have a chest CT done at one place. One radiologist reads it, they're like, oh, and I typed radiology reports for 30 years. And radiology is very formatted. Like a lot of them will have templates that they use, and they're just popping these things like they go really quickly. So they use a template and they don't add extra, but that doesn't mean that there isn't an incidental finding, and keep an eye out for those incidental findings. And this really gets into, this is kind of my big thing. Know how to access your chart, know what's in your chart, know how to read what's in your chart. And if you have questions about it, ask. It's these little incidental things like, oh, hey, you have an incidental finding. There's a nodule in your left adrenal gland. Oh, that was not there a year ago. Huh. Wasn't there a year before that either. So it's all of a sudden, and that actually is one of my problems right now. I probably have Cushing's disease. And that little nodule is contributing to that. Which is contributing to my high blood pressure and a lot of other symptoms as well. So.
And it's also, I mean, it's super important to have the incidental findings noted in your own records so that you can follow up on those things yourself as well. But the other important part of going through your information on your chart is looking for errors, because you could have a doctor making decisions based on incorrect information. And you don't want that. That doesn't lead anywhere good.
I have literally taken someone to the ER. They were incapacitated. I was able to go back with this person. I knew this person's history, and I knew their allergies, and they handed me the paperwork, and I looked, and there were 5 allergies. The 2 that this person had anaphylactic reactions to, they had listed as anxiety.
Oh gosh.
And one of them was something they tried to give her in the ER, and I was like, no. And that's something that we've run into a lot. And I understand it gets hectic. It's just chaotic, especially right now in medicine. They're understaffed, they're overworked. But this is something that could really make a big impact in your life in a not very good way. So know what's in your chart.
Absolutely.
And if you see something that is not okay, bring it up.
Right. And do it when you're feeling well, because there are times where we're not feeling well and we're still responsible for managing our own care and being certain that we're getting the right things or being, tested the right way or whatever. The allergies or the medications are all correct. That shouldn't have to be something that you're worrying about when you're worrying about an acute health problem as well.
Exactly. And this is another, like, if you don't know how to access your chart, reach out to the doctor's business office or whatever front desk reception, or if it's something where they use my chart, which is what I think most systems go with anymore. It integrates really nicely with others because so many systems use it. It's all of your records across like several different systems might be in there, which is very, very, very convenient. And if you need help with that, just ask for help. In fact, I'm going to put myself out there and, hey, if you need help navigating it, I can try to, I don't know, but do talk to your doctor's office. They can help you kind of navigate through that.
Yeah, absolutely. Absolutely. And if you have to go with paper, I see nothing wrong with paper personally. I mean, I know technology is great, but technology isn't always available when you need it. Or some people have limited access. So yeah, absolutely. If you've got to get a printout, get a printout. But yes, it's much easier if you can integrate, if the systems do. I have my chart for some of my stuff as well, but it doesn't integrate with the other stuff I have.
Yeah, that's my problem right now. I've got my chart and I've got not
Mhm,
my chart.
not
And
my chart.
never the two shall meet. And so I just sit there and I like screenshot and I send it to my doctor. Hey, dude, this is what it was last year.
Right.
Um,
Right.
and
Yeah.
I really appreciate the long COVID clinic that I see here in Kansas City. They actually called months before they opened. They were like, "Hey, what do we need to know?" And I thought,
Nice.
"Wow, I like you already."
Yeah.
And they listen. They really listen. They may not have answers, but gosh, that it's really nice to hear. We don't know, but tell us more. Tell us what you know.
Right.
I
Right.
can't tell you how much I appreciate that.
That long COVID diagnosis is so elusive for some of us. And I think it's helpful to remember that it's not necessarily that you need a long COVID diagnosis to get treated. You might in a long COVID clinic, but if you can't get it, if you're beating your head against a wall and you just can't get the diagnosis you need, it's okay to temporarily have them treat each problem. And if you've got to go to cardiology for your heart stuff and pulmonology for your lung stuff, and you don't have a cohesive clinic, if you're still getting care, it's not the end of the world.
Yeah.
And you may actually be treated better. I'm not positive. Depends on who they're using at the COVID
Yeah.
clinic.
All right.
But don't get discouraged if it takes a little while to get a long COVID diagnosis. And I know a lot of people are needing something for disability or insurance purposes or whatever. But if you've got, say, heart failure, myocarditis, something, significant that's damaged your heart, that may be enough to qualify you for
Yeah.
disability while you're waiting for a long COVID diagnosis. So don't give
Yeah.
up, but don't get discouraged either.
Yeah. We've
It
got a
may
really
not be what
great
you need.
advocate, or I'm sorry, we've got a really great disability advocate in the group, Beryl Hudson.
Sure.
Yeah, she's wonderful. We did a town hall with her a while back. And with disability, you want to put everything on there, document everything, note everything, every single thing.
Mhm.
And if you want help with that, reach out and I'll try to connect you with Beryl. She's a saint. I love her.
She is
Um,
wonderful. She
and
is
that
wonderful.
oh, she is. She's so kind.
Right.
And lean into your support systems. There are times where I don't know about you, but I just want to like tap out sometimes, and I'm done with this for the day.
Yeah,
But it's okay. It's okay. Come
it
lean into your
is.
support systems. Look for commonalities and ask, hey, is it? When we first started the group, we started that symptom list, and it was like, oh hey, got this
Oh.
weird thing going on. Yeah, put that on the list.
Mhm.
300 things later, oh, that's a big list. And it wasn't just like one or two people noting something, it was like
Right.
hundreds of people. Oh, my teeth
Right.
are chipping. What? That was not something I would think with pneumonia.
Right.
But then it's not even a true pneumonia. But yeah, lean
It's
into your
true.
support systems for, yeah, just the backup that you need. Because we don't always get that validation. It can be
Right.
hard. So
Right.
go, yeah,
And I
bounce
think
ideas around.
yeah, I think it's helpful to present those to your doctor as well in a certain context.
Yeah,
I mean, I wouldn't go, "Hey, I Googled it and Google says."
Dr. Google.
They don't always like
Yeah.
that. But if you say, I've noticed in this group that I'm in, there are a lot of people who are having a similar issue. Could we look at something like this and see what your doctor has to say? See if maybe they've noticed the same thing in their patient base. Um, some have seen enough people to have that
Yeah.
similar experience, some haven't, so that's okay,
Yeah.
but at least you've presented it as a direction to go, um, or at least an avenue to follow, to look into more information for.
And at first, when we first started that symptom list, people were just printing out the symptom list and bringing it in and showing their doctors.
Yeah,
There are 300 other people with the same thing here. It's not just me.
right,
So
right.
it became a validating tool. It was kind of cool.
Yeah,
Um,
yeah.
and do take note of everything, because if we're not taking note of every single thing, we're missing a piece of the puzzle. So, and you
That
don't
can
have
be
to
so
dump everything
time
in.
consuming.
It is. It is.
Like 200 symptoms later, I'm still finding new things. And I'm
Right?
not sure,
Oh my gosh.
not sure that I want to try and
I'm
keep
kind of
going.
done
Like,
with new things. Yeah, like I said, at this point, I haven't picked up my app in forever to, like, for a while. Like that first year, I was like, every day I've got this GI symptom, I've got this, I've got that. And after a while, I was like, yeah, all
yeah,
right. I'm not
So
all right, but
not all right.
yeah.
But it is important. I mean, and for research purposes too, if there's a way to get into research for some folks who want to participate, they would be able to
Yeah,
benefit from a full list of symptoms,
exactly.
even the things that seem not as urgent.
Yeah. Yeah, and
Yeah.
it's good to find out, we go in for these tests and a lot of times they come back normal or negative. Okay, that didn't work. It's not working for anybody. What does one that really stands out to me, really early on, people were going in for swallow studies, like a barium swallow study. The swallow
Yeah.
study would come back normal. Someone went in and had a manometry study instead, and that started showing the swallowing abnormalities. It was like,
Mhm.
okay. So when you go in to see speech language pathology, let them know, hey, we're seeing this.
Right.
Just as another avenue to explore. Obviously, they're going to make you do the barium study as well, but it's another tool in your arsenal.
Absolutely. And if you don't see, I mean, going back through all of the posts and such over the years, if you don't see in the search what you're looking for exactly, you can always just post in the group and say,
Yeah.
hey, or post on the page and say, hey, this is what I'm seeing. Is anybody else seeing this? And sometimes you'd be surprised how many answers pop up, right?
300 hands are like, ding.
Yeah, 300 of us.
Yeah, and that kind of it's just sort of as a side note, when we are posting things like that in the group, some people are brand new to this, and some of us have been doing this for going on 3 years. Just go into this with grace and with compassion, with patience, because we were there at one point too. We didn't know. We had a lot of questions, but someone had to go through that jungle with the machete first, making the path. And if every person who comes along doing that makes it better for the people behind us. So
right. The dark ages, BC.
BC, that's right, the BC.
We're ancient. We are.
Yes. As an archaeologist, I agree. And make sure when you go in, this is extremely important. When you go in to see any doctor, make sure you are telling them every medication you're on, every supplement as well. We have a very strict rule in the group. Yeah. The strict rule in the group, rule number 1, has nothing to do with Fight Club, everything to do with do not give medical advice. And this is, and people sort of, a lot of times we have people who push back, well, it's a vitamin, it's not a medicine, it's a supplement, it's not a medicine. No. It has a pharmacokinetic and a pharmacodynamic effect. It matters, and it does have interactions. You need to let them know everything you're on. There are some things that do not play well together. There are supplements that you should not be taking, like with blood thinners.
Right.
It's bad news bears. So write everything down so that your doctor has the fullest picture possible.
Absolutely. That's always a good idea. And make sure the dosages are correct and the number of times you take it a day are correct, because if you change any of those little details, it can make a big difference. You suddenly go from a perfectly acceptable dose to too much or too little or whatever for you. Yeah. And that's important for them to know.
Yeah, I've seen some frankly dangerous things out there, like, oh, don't mix that at all. And there are things that like with proteolytic enzymes, you don't want to mix that with a blood thinner. Like, don't do that. Don't double up on proteolytic enzymes. This is, and I know we're desperate for treatment, for answers. Let's not be so desperate that we do more harm than we do good.
Absolutely true. Yeah. And for heaven's sakes, don't recommend it on the pages, medical advice.
Oh my gosh, yeah. It's fine in the group if you want to say this is what worked for me, but you just can't. Even if you are a licensed physician, you still should not be doing that online, and you could actually have your license suspended for that. So and I think we sort of touched on this. I'm scrolling through my notes here. We sort of touched on this, knowing how to read your chart. When it comes to radiology, especially, any study, don't just look at the bottom where they list out everything that they found or didn't find. Look at the body, like the actual body of the report, because that's where you're going to find these incidental things that don't make it to the bottom. Though that is where that's where these little nuggets are. And this was what I had a problem with my first cardiologist. He was, oh, it's no big deal. I know I'm not worried about it, but I need to move it down here to the bottom so that it carries forward, so that it's seen every time.
Right,
Otherwise, it's just lost.
right,
And this could be something that has an impact later on.
right. And it's also important to keep an eye on measurements of things. Is there a size change? Is there a texture change? Is
Yeah.
there, any kind of a change other than just something new popping up? I mean, pre-existing spots. It's always important to kind of go back and check those things.
Yeah,
Yeah.
I went through a lot of testing 10 years ago after my hair fell out, like a lot of testing. And but I wasn't able to access my chart at the time. So I had to, don't just rely on, oh, well, they called and they said it's normal. Go and look.
Yeah.
Don't actually look to see what that report says, because when they call, they're just looking at the bottom. They're not
Right.
looking at the body of the report.
Right.
And there were things that, oh, shoot, you told me that test was normal, and I'm looking at it now, and none of it was normal.
Right.
So
Right.
that was kind of a, that was sort of I was so desperate for answers. It kind of made me a little mad, but
Sure. And I mean, each person is different as well. So what's within normal range for one person, if you're at the high end of the normal range, that may not be normal for you. You may
exactly.
typically run lower. And that's something you would never know. It wouldn't trigger up. It would just look as normal to whoever's reading the report. But if you know that you're typically at a different number for something and
Yeah.
it's changed, that's something you can address with your doctor and ask, hey, what's the significance of this, do you think? And see what they have to say.
Yeah, and note changes over time as well.
Yeah. Right.
So, like, I was on a medication for about 10 years. For whatever reason, it's just this particular formulation of this medication, an extended release that changes your TSH levels. It's not that there's anything wrong with there wasn't anything wrong with my thyroid. It was just that medication doing that. And
Right.
it normalized after I stopped taking it. But it's important to note these changes over time as well. Know what your normals are.
Yeah.
And it kind of prepares you for, okay, this is different. Let's go down this avenue to see what else we can find.
Right. Right.
So, and here we've got a question. I'll read it off here. I could use some pointers on self-advocacy with friends and family members on getting them to understand our need to take special precautions to avoid reinfection. The CDC ignores us when it comes to setting mask recommendations, focusing only on death and hospitalizations. Its recommendations for isolation and masking after suspected infection are tailored to the average Joe, who will just get a little sick for 2 weeks, not us. So, how do I convince people close to me to do more than the CDC recommends? And that is a tricky thing.
That is tough. There's a lot wrapped up in that because so many people feel very strongly one way or another about lots of pieces of that, the CDC or masking or long COVID or illness in general and disability in general. That is tough. It's very tough, but there's information that we can share. There's articles that are starting to come out pretty steadily now discussing long COVID and the issues around long COVID that you can share with your family.
Reinfection, what reinfection does.
Yes. And how horrible it can be to be reinfected as a long hauler.
Yeah.
Some people have a lot of experience with that.
Yeah, I can't believe how much this last round took it out of me. Like right away it was bad, but a couple months out now, I'm like, stairs are impossible. I can't believe, like, I'm used to going out and digging holes in a field all day in 100 degrees. I have problems going up my stairs now.
Yeah.
So these repeated hits. One thing, when you are in a situation like that, you're probably, you really, it's hard. You really can't expect to teach or reach. So one trick that I do, instead of trying to tell them something, I just ask questions so that I can sort of, it lets them know I'm listening to you. I want to know how you reach this conclusion. Tell me more about what you think. And it opens up a dialogue. But yeah, it's just go into it knowing you are not going to change any hearts and minds today. So go in asking questions.
Right.
It sort of, it disarms people, and it makes it a little bit easier to talk about.
Right. I agree. And I know that there are starting to be folks who are having feedback that isn't exactly positive from strangers, if they are now requiring a walker or requiring a mobilization device like a wheelchair or something, and not obviously visibly terrifyingly disabled now, in invisible illness, and like getting up from your wheelchair to grab something off the shelf, and then all of a sudden you hear from 3 aisles over, it's a miracle, this person is healed. Yeah, it's really hard to face those kinds of situations. And yes, I agree with you. You can't go into it thinking you're going to change hearts and minds in one day, but you can present what you know and let it be enough. Let it be enough. Maybe somewhere it sinks in, but if you feel like you're going to get a fight from it, that may not
It's
be
not
the
gonna do
best
any
place
good.
to spend your energy.
Yeah, it's not going to do any
Yeah.
good. And you don't need to get your blood pressure up any higher than it already is.
Or your heart rate, because you
Yeah.
just stood up.
Right? You're going to be lying back down real soon.
Yeah,
Yeah.
that's not fun. It's not fun
And
at all.
the unfortunate truth is that as time goes on, some of these people who didn't believe us are now in the group. So,
Yeah. Yeah.
and the important thing is that we're all here. We're all here now. It almost doesn't matter how we got here. We're here now. Just go into it with grace.
Right.
So,
Or when. It doesn't matter when we got here.
Yeah.
The new long haulers are just as ill as the older, more experienced long haulers have been too.
The
And
March 2020 crew, y'all are still pretty sick.
we are all still pretty sick. We are, but I mean,
was about
it's
March
so
2020.
scary and confusing to somebody who's like, I've had COVID 3 times already. Why now am I getting this? Why am I having this impact now?
Repeated hits.
Yeah, they thought that they were doing okay, and they're not doing okay anymore. And I wish more of those people were able to share at this point with the outside world, with the others who didn't believe in it before either and thought that it was all going to be okay, because there's no guarantees. There's no guarantees. Each infection is new and behaves in its own unique way.
Yeah, and it unfortunately does take a very sobering moment for some people to really recognize how serious this is. My little hometown, Joplin, Missouri, was in the news all last summer for Delta. It was a bloodbath. It was just a bloodbath. It was awful. People were dying left and right. People were being disabled left and right. It's a rather let's just say I don't really follow the politics of my upbringing, but they were the first municipality in the state of Missouri to reach 50% fully vaxxed. They were kind of taken aback at how horrific it was.
Yeah.
So I just recognize that, hey, we've all been in that position, like where we didn't know until we had to find out the hard way. So
Right.
Yeah. And I get a lot of messages, oh my gosh, I saw what you were saying, but it didn't really sink in until it hit me. So, and I think that's how everybody out there who hasn't been affected by it, I think that is kind of the mindset that they have. Oh, it's not going to be me. Yeah, it could totally be you. I don't care if you did Ironman before; it could be you.
Yeah.
You can't really boost your immune system to fight this. That's not a thing.
Well, except for vaccination.
Well, that's a different thing. I'm talking like people ask all the time, well, what supplements can I take to boost my immune system?
Yeah.
No, it's not. We still have to be following all the protocols that we need to be throwing a lot more at this than we are. I don't know if you've heard of the Swiss cheese model of because like in a brick of cheese, it's got holes in different parts. Once you put all those parts together, it makes it harder for that virus to spread. So.
Right, you got a little stronger barrier. Yeah, there's lots of pieces in that. Taking care of each other is a big one. So masking whenever you can, because I know it's really tempting, especially if you've had an infection and you struggled through that and so you're not feeling quite right again. It's easy to say, this isn't the way I felt the first time. I'm probably not sick. I think this has got to be something else. And that's not necessarily the case either. Each infection's different. It's
Yeah.
unique and you react in completely different ways, even though it's technically the same virus. Your body is just doing something different the second or third or fourth time around. And you
Yeah.
can't assume that you're fine because you just don't feel the way you did the first time.
Yeah. And that, yeah, it's like each time I've had it, it's been different. And the
Mhm.
long COVID symptoms following it have been different.
Mhm.
Although the cardiac symptoms this past time are like, I'm not too fond of this. It's
Yeah.
just kind of getting worse. Don't like it.
Reminds you of round one, huh?
No, round one was all pulmonary for me.
Oh, really?
I didn't have any cardiac issues after round one at all.
Wow. See, there you go.
Yep.
They're all different.
It was round two that got me. And round three, oh my gosh. This is not
Yeah.
cool, man. This is not cool.
Not cool. Wear your
No.
masks. Please.
Yeah. Yeah, wear your mask. Do everything you can. And make sure you've got like a good quality mask. Cloth masks are not going to help you right now. Get yourself some N95s or any of the masks that have like a good, and you need a good seal. Make sure you've got a good seal on there.
Right.
But it really, until we stop seeing this as a personal health issue, we have to put public health first. Because if we don't put public health first, we can't have personal health.
Yeah.
And that's kind of the bottom line of this. It's not a
Exactly.
personal responsibility thing, it's a group responsibility. Yeah, failing.
And that's a great way to approach it with these people who are not understanding the significance of how we feel now as long haulers. You know, that's a great way to share that. I wear my mask so you don't feel like I feel right now.
Yeah.
And here's why I don't want you to feel this way. You know, here's what I'm experiencing. And sometimes
here's my diastolic.
Yeah. Right. Your pulse rate is what?
Yeah. You want this?
Mm-hmm.
Yeah. Oh, you don't want this. Put on a mask.
Yeah. Put on a mask. I'm trying to share so that you don't have this issue.
Right.
And sometimes maybe it'll make an impression over time, perhaps.
Every now and then. Every now and then.
Yeah. Yeah.
Oh, good question. So how do we get doctors to give us the medicines we know will help us? I found that if you ask for a particular med, it's the last thing you'll be prescribed.
That's true.
Yeah, tricky. I see you out there, audience.
I've had that happen too. Yeah.
Yeah.
Okay. So I have a little story about that too, because I have a story about everything. I was prescribed beta blockers because of the dysautonomia issue, and they worked really well. They worked so well that when I had to change doctors, the second cardiologist that I saw said, you know, I don't really think you have a problem. I don't think you need these. Let's do a monitor. Don't change anything you're doing. Do all your interventions, but let's do a monitor for a week and see what happens. So I changed nothing and I did all of the stuff I normally do, which is sit down when I start to get dizzy when I stand up and, you know, all of the electrolytes and the medication. And of course, it came back relatively normal. I had some elevations that were significant because I was inactive, but you can't really indicate that on the monitor. So, you know, he's like, yep, your heart rate stayed between 40 and 150. So you're good to go.
It's kind of a wide berth there.
Okay.
40, I'm not dead yet.
I'm not dead yet. I'm feeling better. So he said, why don't we start tapering off the medication? You don't need it anymore. So
it's doing its job.
I thought to myself, well, this will be interesting. And I kind of cleared my schedule for the next couple of weeks, knowing that I wasn't going to feel real well. And I ran with it because I was sure I was not going to change his mind. He had that demeanor where he was super confident that I was just, you know, a little bit of the dramatic soul and, you know, kind of maybe emphasizing more than I needed to. So I stopped. I tapered off. And I had 25 high heart rate warnings on my monitor and took it back to him and said, what do you think? And he said, I think we're going to start you back on that beta blocker. Yeah, I think so. So if you know there's something that will probably help you and you're concerned that your doctor is going to be really resistant to it, my suggestion would be see what they say, see what they do suggest. So you're treating something, obviously, if you're asking for medication, if you've got a mast cell type issue where you're reacting to everything and you want to see what antihistamines will do, and your doctor says, I don't think you have a problem, then see what they do suggest, because it may be that they have something else in mind that probably won't help as much as you want it to, because it's not the right thing. But if you show them, I'm willing to hear what you have to say, I'm willing to try this for a short period of time, and then I'm coming back at you with the results so that you know that didn't do it.
Me and my 15,000 friends.
That's right. I got a group behind me who says that didn't work for them either. And then maybe they'll be a little more receptive. You've heard what they had to say. Now they'll be a little more receptive to hearing what you have to say. I understand we're already miserable, and you don't want to be miserable any longer than you absolutely have to be. And if you think something's really going to be the golden ticket, and you really feel like your doctor might be somewhat receptive to hearing that, ask what they think about it. Don't ask for it. Say, I've heard about this thing. What do you think about this thing? And see what they have to say. Sometimes there's reasoning that they don't communicate with you if you don't ask about it. So they may have experience with that drug in other people that didn't work the way they wanted it to, or they may have another drug in mind that they think does the same thing and works better. Just see what their reasoning is, because it may be that there's a compromise to be found there. If you kind of interchange their thoughts and your thoughts, interact and see what you think. It's possible. And if it doesn't work and you still really want that particular drug, then you can go back and say, I've tried this and this didn't work. And what about it now? And see what they have to say.
We've got 2 more questions here. I'm gonna come back to Kimberly. So let's skip down to Roberta really quick. So I've not gotten vaccinated because I personally don't see what it does. I've seen so many vaccinated friends get COVID and get just as sick as I have gotten, or even worse. I get all my other vaccines. Well, this is really important to know, especially with the COVID vaccines. They keep hospital beds open. That is your big thing.
Yeah.
We have to keep these hospital beds open.
Yep.
That is what they're doing right now. Okay. It's not a magic force field. It's not Harry Potter or Star Wars where it's going to deflect no. It lessens the severity and it keeps hospital beds open. Absolutely. And at the rate we're going right now, this is not going to be a pretty winter. So, but since we do have the updated boosters out, definitely go get it if you can. And everyone who can get it should get it, so that those who can't are more protected. This is, again, it's a group project.
Yep. Absolutely.
So I'm going to skip back up to Kimberly here. I'm dismayed about the abandonment of masking that rapidly followed the president's proclamation that the pandemic is over, and the CDC's subsequent relaxation of masking policy for hospitals and care facilities. Me too.
Yep.
This seems to have affected masking decisions much more broadly. Today, at my special compounding pharmacy, the pharmacist and employees were all maskless. Oh my gosh. Last time I was there, everyone was masked. Dealing with family refusing to mask is one thing. Dealing with healthcare providers is another. Any recommendations? Absolutely. In this case, I'm that person. I would just be like, I'm sorry, you are endangering my life. I am your customer. You are endangering my life. You are endangering the lives of everyone around. It's not a big ask. Yeah. You can say it politely, but assertively, that no, this is not acceptable.
Yeah.
I don't know. Donna, you're probably nicer than I am. I just have
well, I was just sitting here thinking, I might not have used those words exactly. I might have said, I'd feel a lot more comfortable if you were masked. Could you please do that? Nicer than I am. Well, I might not get hurt as well as you do, though. So there's that. But what I would do is make sure that I am keeping distance from the counter. If, as long as humanly possible. I'm talking from way back here. And, if you have to shout to hear me, so be it. Or for me to hear you, so be it. Use your other interventions as much as you can. Make sure you've got that hand sanitizer right there with you if you touch the pins and stuff. Don't make a big display out of it.
Yeah.
I would definitely make sure that I'm doing the things in view that protect me. And I would absolutely say something. Yes, indeed.
Yeah.
Especially in a medical office. That is almost inexcusable as far as I get. Yeah. I can't think of a good way to say that. I'm not coming if you're not masking.
Yeah.
At some point, I understand at some point you've got to open things up a little bit
This is
more.
not
I
that point.
understand that you can't live like that forever, but you can put a mask on, for heaven's sakes.
Right? It's not a big ask. It's just
It's
not.
not a big deal. It's really not, especially in a medical setting.
Yeah.
So I'm really, really sorry that you're experiencing that. You're going to probably have to lead by example there.
Yeah.
That's wow, that stinks. I'm sorry.
Yeah, I'll go with you. Okay, Kimberly? Can you
Yeah,
take me
we'll,
with you? Don't do that. I have
we'll
a big mouth.
Zoom. We'll bless them out over the phone.
I'm working. I know I tend to be not just frank, but blunt sometimes. I'm working on it, but sometimes this is not cool.
It isn't cool. I mean, and like I said, you probably get heard more than I do. I do tend to be a little bit more passive about those kinds of things, but I'm also not the squeaky wheel that gets heard. So
Yeah.
there we go. Mine is the slow approach, I suppose.
Trying to think of like a gigantic, what would you call a gigantic squeaky wheel? I don't know.
Sure, either.
The shot heard round the world. Oh my gosh.
Yep, not me.
Well, we've made, I don't see any more questions, and we've made it through our notes, and we are spot on time. So thank you everyone for being here. Yeah. Oh, yeah. Sometimes I freeze in those situations too, but this is where having a theater background really comes in handy. Like, I just joined theater, Amanda. Hey, I'm gonna put this nervousness and anxiety aside, and I'm just gonna go into the, it's a whole mindset.
Yeah, and it's perfectly okay. I'm one who tends to freeze too, or I get so shocked that I'm just like,
right?
What did you just, what just got said there? It's okay to say, I'm extremely uncomfortable with this. And that's not aggressive. That's not mean. It's not hateful, but it's voicing how you feel. I am very uncomfortable with this. This is not what I bargained for here. That's okay. That's not too confrontational for some of us who tend to be a little bit more passive. And in the headlights.
Print out copies of all those studies detailing what repeated reinfections do.
Yeah.
Pass it here.
Yeah, because I'm sure those pharmacy personnel are experiencing reinfections as well. As many people as they see, if they're not masking, I'm sure they're having the same issues. Oh,
well, thank you so much for your time today, Donna. And thank you everyone for being here.
Thank you.
I am going to hit this little red button, and I will probably see you in DMs in like 5 minutes.
Okay.
Bye.